Hello everybody, me and hubby here doing another massage cupping video. Today we're going to do his shoulders. Look at this lovely tunic that we made. I wanted to give him some modesty still while showing you how I cup the shoulders, whether it be the back or the side or the front of the shoulder. We're also going to be doing a little cupping on the clavicle or the collarbone, because when people have tightness in the back and in the shoulders, sometimes it's because there's tightness in the front of the area of the body. It could be on the clavicle, it could be the pecs, but I'm just going to show you how I get the clavicle, shoulders, and the back. So I hope you are going to enjoy this video, and I hope that you will like this video, subscribe to this video, and ring the bell so that you can get more videos like this. And let's get started. Okay. So I am going to put some massage cream on my husband's shoulder, and this is my special concoction. I have made this with many wonderful essential oils, and I love this concoction because it smells good. It's minty, but it does the trick in terms of relieving pain as well, and everybody loves it. So I'm just going to use the cup this is my lymphatic drainage cup, by the way, in case you have not seen previous videos where I show how I use this cup to open up the tissue to do some lymphatic drainage to the area, and to just gently introduce a person to cupping for the first time. It's really light, it's really gentle, and it's very effective. It brings great blood flow and oxygen flow to the area, and it helps to decompress the tissue and open up the muscles, expand the muscles, expand the tendons, give a really nice gentle treatment in the area that we're working on. So now that I've opened up the area, I am going to put on some suction cups, and you've seen me use these suction cups before. These are my medium weight suction cups, and I basically just squeeze the cup to deflate it and place it on the skin and let go of it and allow it to suction the skin. And I'm going to put another cup on the back of my husband's shoulder, and same thing, press, place, and suction. And I'm going to put one on the deltoid, and the reason is because we want to open up the entire area. So we've done that. We've put one up here closer to the neck, and we've put another one right at the front. How does it feel, hon?
Feels great.
Feels great. Too tight or
no?
Just right?
Just right.
Just right. I love that. That's what you want to hear. And I put one just below his collarbone, on the pectoral muscle here, because I want to open everything up right there, and one right on top. Okay, so we've got about 1, 2, 3, 4, 5, 6, 7 cups going, and it is really decompressing the shoulder and a little bit of the pectoral muscles and a little bit of the traps, the trapezius muscles in the back, and it's allowing him to feel a little bit of expansion and decompression of the muscles. So I will leave these cups on for about 15 minutes, and then I'll make sure I balance him off by doing the other shoulder on the other side. And in the meantime, I'm going to have him do some rotations for us, just so that we can do some mobilization of the shoulder joint. Okay, and I'm going to leave him to do it on his own. Okay, and then let's just open it out sideways. Perfect. How does it feel? Okay, now I'm going to do something different. Can you bring it across your chest and hold it with your other arm? Okay, and this gives a great stretch right here, right here. And while he's doing that, he didn't know this was coming, but it's coming. I'm going to get my lymphatic drainage cup out, and I am just going to do some cupping in this space, this open space here, because if he's got a lot of tightness, especially in these teres minor muscles, a lot of these rotator cuff muscles, that need some loosening up, this is going to help him tremendously. So he's already got some stationary cupping happening, and now he's got some gentle lymphatic drainage cupping happening, but it's gliding cupping that is opening everything up. So sometimes doing a combination of different types of cupping will help. Now you can release, hun. It'll help the issue that someone is having, because you're doing a lot of different dynamic things that are helping to relieve the issue, whether it's tension, tightness, pain, soreness of muscles, whether it's a lack of circulation in the area. You're really helping to improve things. So that's why I like to show you different things that we're doing. So now I am going to take off one of the cups at a time, just very slowly, see what happens. You might notice redness on the area. Let's see, any redness? Very, very light, mild redness. Not a lot, nothing to write home about. Usually this cup is the one that has a lot of redness in the area. And take this one off. Sometimes you'll see swelling, and that's just, you know, inflammation that might be there. It is the suction marks from the cups as well, but often it is a sign that there is dampness in the body, and it is also a sign that there is inflammation in the body. So I'm gonna leave this one on a little longer, and they're very, very light pink marks, and that might just be because the blood has been suctioned up to that area, but it'll go away within about 10 minutes or so. If it doesn't, then we know that there's more happening in there, and we would like to detox it out, and the body will do that. We'll make sure we drink a lot of water in order to detox the area. So I am now going to get my biomagnetic cups. There is not a magnet in there, and these are actually called Kanju cups. That's the official name of it, but not a lot of people know that, and I thought I'd teach you something new today. So I am gently gliding these cups along my husband's shoulder and back, and just, I'm gonna have you look that way, hun, so I can get under there. Just face that way for me, thank you. That way I don't bump into his lovely face. And I am cupping his clavicle, his collarbone. And I can feel the collarbone, and usually people don't realize how tight it is. Was it a little tight, hun?
Yeah.
More than you expected, eh?
Yeah.
So sometimes it's very tight, and when it's tight there, that's when you know that someone's got issues in the neck. So I will then just gently slide down. I might even get a smaller cup just because I want to be able to get in there a little easier, and I'll go right behind the neck. I'll go to the attachment of the SCM, the sternocleidomastoid muscle, which is just behind the ear, and then I will stroke down along the shoulder, and I will do some gliding cupping along the front of the chest. So, hun, if you can do me a favor, because I like to see this muscle pop, it helps me if you stay this way and if I turn you that way. And sometimes you can see it or you can feel it. It connects right to the clavicle or to the collarbone. So what I'm going to do is I'm just going to do a little bit of a suction and release on that SCM muscle, okay? And it just connects right to that sternum, that manubrium right there, okay? And I'm getting the other head of that muscle, which is just on the collarbone, on the clavicle. And that's why I'm cupping the clavicle, because if I get that clavicle, also known as collarbone, and I get the insertion of that SCM muscle, then I know that I am going to loosen things up tremendously. And I do a nice suction and release all along the area. And then do some gliding cupping to open everything up. Now I'm going to take this one off. It's on the tip of the shoulder, and it's got a little bit of redness in there. You'll generally see more redness in this area, especially, you know, if it's right on the acromion process. you're gonna notice how tight it is because there's so much work and mobility and movement in that area of the shoulder. So I'm just doing some suctioning with my biomagnetic cups, and now I'm just doing the final lymphatic drainage. That's the key. When you finish your cupping, doing lymphatic drainage. When you drain everything that you dredged up, all the stagnation, all the toxins that you've pulled up to the surface, you will lightly cup out of the body towards the auxiliary lymph nodes in the armpit in this case. And those lymph nodes are helping to clear out the toxins for you even better. And I am doing it to the front of the shoulder now so that you can see. We did a lot of work in the back because the back is where you usually have a lot of issues, but I'm draining to the armpit to get the lymph nodes, auxiliary lymph nodes working and helping to clear things up even faster. So that is it for our treatment today. Just to do a recap, we worked on the shoulder, we worked on the back, we worked on the clavicle, also known as the collarbone. We did a little bit of the pectoralis muscles, and we did the sternocleidomastoid muscle, and we did some lymphatic drainage in the area. There are a few red marks. I can see this one is quite red here. Actually, it's pretty light. Sometimes it can get very, very deep red, very dark, and a little bit of redness here. Let's see the backhand. Maybe we can turn a little bit. Yeah, just a touch. Just a touch. Yeah, okay, thanks. Turn back for me. So now that we've finished this side, I am going to finish up my husband's other shoulder. And again, if you have any questions, please let me know. Please comment, please subscribe, ring that bell to get more videos, and you have a great day. Bye, everybody.
Bye.